Okay, I think we should get started. Welcome everybody. First, I'd like to highlight the interpretation. For those of you who are Spanish speakers, please, at the bottom there's a little globe. Click on that, and you can click on Spanish to hear it in Spanish. And Israel is our Spanish interpreter. And for those using sign language, Ramon Wolf and Adam McCormick will be the two sign language interpreters. So you can pin on them. And I think that means we can be ready to start. So welcome everyone to the first ever session on the Global Disability Summit having to do with budgeting. Budgeting drives and reflects the priorities of the government, and therefore it's very important for monitoring policies to be able to look at budgets through a disability lens. And in today's session, we're going to look at some of the principles of how one does inclusive budgeting, some country examples of where this is taking place, some tools we can use. And finally, we're going to end with framing that budgeting in the context, a broader context of fiscal policy. We have a lot of great speakers and limited time, so I'm going to get right to it. And our first speaker is Alex Coate, a policy specialist at the Disability and Social Protection Unit at UNICEF headquarters, who's going to talk about some of the key elements for CRPD compliance in budgeting. So Alex, please take it away.
Thank you very much, Dan, and thank you all colleagues for joining us today. So I just would like to share a few key elements when we talk about CRPD compliant budgeting. I think it's important also to state that to date, there is no formal guidance from the CRPD committee along those lines. Unlike the CRC, who have, for instance, a general comment on public budget. There is no such thing yet from the CRPD committee, but there have been, along the years, many references from the CRPD committee around budget. And looking at that, we have tried basically to build a first framework. So first of all, when we talk about public finance, and CRPD, we are talking about all budgets in a country, including central and local government budget. We are also looking at domestic resources, which are generated by taxation or other ways, as well as international resources, which can be grant from official development assistance or loans, among others. At the core of CRPD compliant budgeting, there is meaningful consultation with organizations of persons with disabilities. And some of the first elements that we will look at is ensuring that public budget do no harm, which means that they do not contribute to build new barriers, which would be purchasing buses or new buildings, services that are not accessible or inclusive. And the second one is, of course, not financing programs or services that undermine inclusion. Here we think about residential care institutions instead of investing into community support services. But doing no harm is not enough. Of course, what we want is all resources across ministries and level government contributing to inclusive infrastructure, policies, programs, and services. And here it's very important to highlight across all ministries, as we will see with our speakers today, that in many countries, very few ministries are actually spending on disability. And usually, if you look in most low and middle income countries, you will have few main spenders: Ministry of Social Affairs, Ministry of Education, Ministry of Health. While inclusion is, of course, about every single ministry taking their share. And this has a big impact on budgeting, because if budgeting and expenditure are concentrated on few ministries, they basically take the burden of everything. And in addition to that, in line with the twin track approach, we need also specific programs, support services for persons with disabilities. And here, one thing that is extremely important is equity in planning, to ensure to the diversity of persons with disability get the support they need. So if we do a budget analysis, we are starting from data about the situation of persons with disabilities. And very often, some work would have been done on the legal framework. Then we analyze what are the current budget allocation, the level of DPO engagement, and the implementation mechanism, the public finance management system. To which extent do they contribute? A second stage is to see, okay, with the existing legislation, policies, and frameworks, what would be the budget required to implement those provisions in this framework that contribute to CRPD? How can we improve DPO engagement and make the PFM system better and more inclusive, so that we increase the realization of rights for more people with disabilities? Ultimately, we need to look at a CRPD compliant framework, as well as all the resources that would be required to implement the CRPD, so that we realize all human rights for all persons with disabilities. And when we assess a budget and a public financial system, we are looking at the level and the use of current public expenditure to see if they are adequately, they are enough and for realizing the rights of persons with disability, and how much more would be needed. Is there any spending that contribute to segregation and exclusion rather than inclusion, and if those funds could be reallocated towards CRPD compliant program or policies? The current level of engagement of organization of persons with disabilities in budget processes and how it could be improved. The level of equity in budget allocation in terms of group of children and adults with disability, gender equality, and also geographic equity. We look at the different elements of the PFM system to see if it contributes to inclusion of persons with disabilities, and it could be problem in utilization of funds or inclusive procurement, and what change are needed. We will hear also from Alberto later on the issue of source of financing. The way government generates resources may have an impact on equity and inclusion. And finally, if there are bottlenecks in the way budgets are executed, the way money is spent and transformed into output and outcome for persons with disabilities, if there are problems, are they ordinary public financial management problem or public administration issues that are impacting everybody, or are there some issues that are specific to disability? And with those elements, we have a very strong basis to start assessing budget and PFM, and we will hear more from our colleagues on how they did that in different countries. Thank you very much.
Great, thank you, Alex. And now we're going to turn to a specific example from Argentina, from Eduardo Quiroga, who's the lawyer of the Disability Rights Program of the Civil Association for Equality and Justice. So Eduardo, please share your screen and time to start. Thanks.
Muchas gracias, Dan. Ahora comparto pantalla. Bueno, sí, se ve correctamente. En primer lugar, muchas gracias por la invitación a participar de este evento y por la posibilidad de compartir con todos la experiencia de ASIG en materia de análisis presupuestario. Les cuento que ASIG es una organización que utiliza el análisis presupuestario como una herramienta fundamental para la incidencia y para promover los derechos económicos, sociales y culturales, bajo el entendimiento de que la forma en que las partidas presupuestarias o los recursos son asignados por el Estado también reflejan las prioridades en la política pública, y en materia de discapacidad lo que hacemos es analizar críticamente el presupuesto, teniendo en consideración las obligaciones que surgen de la Convención sobre los Derechos de las Personas con Discapacidad, para determinar cuántos recursos invierte el Estado y de qué forma efectivamente los distribuye. Para hacerlo, nosotros en ASIG todos los años analizamos la Ley Nacional de Presupuesto, elaborada por el Poder Ejecutivo y que atraviesa su discusión parlamentaria. También analizamos cuáles son las asignaciones durante todo el año, las reasignaciones de los recursos en materia de discapacidad, y finalmente cómo esos recursos durante el año también se ejecutan o terminan invirtiéndose, ya que muchas veces esto es diferente a como estaba originalmente previsto en la Ley Nacional de Presupuesto. En este sentido, comparto algunos elementos generales de la utilidad de nuestro análisis. En primer lugar, nos permite, como mencionaba, analizar si la distribución es conforme a las obligaciones que surgen de la Convención y de la legislación local en materia de discapacidad y derechos humanos. Y eso nos permite visibilizar determinadas situaciones de discriminación o insuficiencia de recursos. Para dar un ejemplo, en materia de salud mental, en Argentina existe una ley que determina ya una pauta presupuestaria, y es que el 10% del gasto total de salud debe destinarse a salud mental. Sin embargo, lo que nosotros analizamos es que este porcentaje no se cumple en nuestro país y está muy lejos de alcanzarse. Menos del 2% del gasto de salud se destina a salud mental, y este análisis nos permite también identificar que gran parte de ese 2% sigue concentrado en políticas destinadas a la institucionalización psiquiátrica y no al cierre de los manicomios o a la creación de dispositivos y servicios de apoyo para la vida en comunidad de las personas con discapacidad psicosocial, y es un dato que realizamos desde ASIG, el monitoreo, y que no está en la discusión pública, pero al analizar el presupuesto nosotros podemos obviamente intentar que se aumenten estos recursos a través de diferentes herramientas, poniéndonos en contacto con legisladores y demás. También otro ejemplo es el caso de la Agencia Nacional de Discapacidad, que es el organismo nacional a cargo de las políticas en materia de discapacidad en Argentina, y que el análisis presupuestario a nosotros nos permite identificar que gran parte del presupuesto destinado a este organismo está concentrado en políticas prestacionales que están basadas en el modelo médico rehabilitador de la discapacidad y no en cumplir las obligaciones de la Convención o en avanzar hacia una redistribución de los recursos hacia políticas inclusivas. En este sentido, siguiendo el segundo punto que menciono, el análisis nos permite controlar también cómo se ejecuta ese presupuesto y su evolución. Ahí dejo el link a una plataforma que tiene ASIG y que permite que todas las personas puedan acceder y controlar la ejecución del presupuesto y que se actualiza diariamente. Un ejemplo de esto es lo que sucede con la política de prestaciones no contributivas en materia de discapacidad, que nosotros a través del presupuesto no solo podemos identificar cuál es el gasto total en materia de protección social, por ejemplo, sino también identificar si estas prestaciones aumentan cada año o si el gobierno decide disminuirlas, y de esta forma también tratar de incidir si identificamos alguna situación de regresividad en materia de protección social, por ejemplo. Un punto importante para nosotros y que creo que hace también a la incidencia es que los legisladores y las legisladoras no analizan el presupuesto de una perspectiva de discapacidad al momento de debatir la ley de presupuesto en Argentina. En este sentido, si no lo hacemos nosotros, si no lo hacemos las organizaciones, nadie lo hace, y lo que nosotros buscamos justamente es hacerle llegar a quienes deciden, a quienes pueden determinar reasignaciones o aumentos en materia de presupuesto, esta perspectiva, porque ellos no la aplican en su análisis, y muchas veces se invisibiliza el tema de la discapacidad en la discusión del presupuesto. Por eso realizamos anualmente semanas destinadas a promover un presupuesto inclusivo, a hacerles llegar a los diferentes decisores públicos y los informes que analizamos. Generamos mesas entre las organizaciones de la sociedad civil y legisladores y legisladoras, tratando de incidir en el debate presupuestario. Por otro lado, también me parecía importante comentarles que utilizamos la información y el análisis presupuestario para otras cuestiones que hacen también a actividades que desarrollamos para incidir en la inclusión de las personas con discapacidad, como es el caso de demandas judiciales contra el Estado nacional o los estados locales de Argentina, porque esta información, por supuesto que permite evidenciar la no priorización y el lugar marginal que ocupan las políticas en materia de discapacidad en la asignación de recursos. También nos permite fundamentar presentaciones ante organismos internacionales y contrastar muchas veces lo que el Estado suele decir en relación a determinadas políticas, por ejemplo, que impulsa políticas en materia laboral, en materia educativa, pero que no se reflejan en el presupuesto. Entonces, si no tienen una asignación presupuestaria determinada, lo cierto es que seguramente esas políticas no alcancen a una gran cantidad de personas, ni verdaderamente tengan el impacto de modificar o garantizar los derechos de este colectivo. También nos permite el análisis presupuestario evitar que los gobiernos se excusen en la falta de recursos a la hora de asignar presupuesto en políticas sociales y contrastar estos argumentos. Con esto me refiero a que muchas veces el gasto en cuestiones o en políticas de discapacidad ocupa un lugar marginal en la asignación de recursos y suele escucharse justamente que el Estado no cuenta con determinados fondos o el costo de determinadas políticas en materia de discapacidad, pero nosotros a través del análisis presupuestario podemos justamente contrastar estos argumentos, evidenciando por un lado que el Estado ya invierte una gran cantidad de recursos en materia de discapacidad, pero que los invierte en base a políticas, como mencionaba anteriormente, contrarias a la Convención, y además nos permite contrastar estos argumentos evidenciando que el Estado también invierte una gran cantidad de recursos en políticas que no son prioritarias en lugar de destinarlas a las políticas de discapacidad. Por último, para finalizar por una cuestión de tiempo, les comento algunos desafíos para cerrar del análisis presupuestario. En primer lugar, la falta de información adecuada y desagregada por discapacidad. Todavía no conseguimos en Argentina que el presupuesto cuente con indicadores, cuente con etiquetas claras que nos permitan identificar de forma efectiva cuáles son las partidas destinadas a discapacidad y cuál es su impacto, cuáles son los resultados de esa inversión. También un gran desafío es que se implementen mecanismos participativos de las personas con discapacidad en cada una de las etapas del diseño presupuestario, desde su ejecución, desde su diseño y rendición de cuentas. Está invisibilizada la obligación de incluir la participación de las personas con discapacidad en el debate presupuestario, cuando son políticas que las afectan directamente. Y por último, el desafío de avanzar justamente hacia diseños presupuestarios inclusivos y acordes a la Convención. Lograr que se comiencen a transferir los recursos de la institucionalización hacia la vida independiente, desde la educación segregada, la educación común, entre otras cuestiones acordes a la Convención. Esto sería todo para compartirles. Obviamente que quedo a disposición para profundizar con quien así lo quiera. Muchas gracias.
Thank you very much, Eduardo, for that presentation and experience in Argentina. Next, we're going to go to Joshko Wakaniasi, who is the Manager for Inclusive Development for the Pacific Disability Forum, who will tell us about the experience in Fiji of using budget analysis for advocacy. So Joshko, over to you.
Thank you, Daniel. Are you sharing screen from your end, Daniel?
Oh, I thought you were going to share your screen.
Okay, 1 minute, please. I'm going to share screen.
There we go.
So can you all see my screen, Daniel?
Yes, we can see it.
Thank you, everybody. Good evening, everybody. Getting right into it, in terms of, I'll share the Fiji experience in terms of budget advocacy over the last few years. Initially, budget advocacy within the OPDs, within Fiji, was based in terms of activities, how much they did for that given period, what was for the year, not so much as per identifying and then seeing what allocations were being provided within government, within the different sectors of government. So the budget advocacy, the budget analysis is more internal in terms of the OPDs in Fiji, especially during their setup. Over the years, this has changed, especially with the integration of UNCRPD in terms of the work that the OPDs have done. There's better understanding in terms of Article 4 and state obligation. That actually started as the momentum and the learnings and the capacity, the training to understand UNCRPD and members on UNCRPD has provided the OPDs to build their own momentum in terms of advocacy. Having said this, since 2013, through the CPAD program, the Care Peace and Development Project that was funded by UNDP, there was a better learning where the OPDs got to see how to start analyzing budgets that were provided by government. So this is where the OPDs started to understand what budget advocacy, what budget analysis can actually do to ensure that their rights can move from or start to transition from being recognized to the realization of rights. So the initial aspect within these early years was to look at the line ministry. I guess the beauty, or as the translation from 2010, since Fiji signed on onto the NCRPD, and 2012 signing on to the NCON strategy, and also in terms of other regional instruments, provided opportunity to grow and expand. I guess to date, Fiji is still learning, still pushing. The OPDs are still very much advocating. But some of the achievements to date in terms of providing appropriate budget analysis and advocacy within the right space and framing it correctly. We have the line ministry providing social protection budgets that's specific to disability, including budget lines that support the OPDs. But also in terms of the area, in terms of education, there's now specific budget grants for students with disability to ensure that their inclusion into mainstream education, rather than that of establishing special schools to institutionalize students with disability. So on one part, it's not only the funding, but also ensuring that the funding is in compliance to what the NCRPD is about. It is the OPDs also identified quite clearly, quite early, when to engage, how to engage. So Fiji, often the OPDs here fully understand that the financial year for government is from August to July. We also are now very familiar that by March each year, the ministries start to prepare their internal budget processes. So this is when the OPDs start to engage with the different ministries. This is when they start engaging their counterparts and start influencing the change internally. It also then looks at what are the benefits, how can they team up? So if the other NGOs, the other civil society organizations, if there are common threads, especially if it's for children, then within the child space, where is the budget for children with disability? When it comes to women's organizations, they'll be providing or submitting their budget plans to government. We then partner, we then approach, our women's organization, other gender-based organizations, in asking where is the dividend, or where is the opportunity to ensure that there is inclusion of persons with disability within these budgetary processes. So it is also crucial to also advocate and lobby to government during these initiatives or these consultative and collaborative approaches on the importance of the benefits. So the simple things of, if you make the environment, say hospitals, more accessible in the upcoming budget. It'll help the elderly. It'll help mothers to take their strollers with their babies. It'll allow for those that are injured to be wheeled in more easily. It'll also allow for better transfer from one ward to another. So providing insights in terms of benefits is always something that the OPDs here in Fiji has actually mastered over the years in doing this. So, as mentioned, the importance of understanding how much you're receiving, understanding what is your target population. So Fiji has changed and what strengthened our budget advocacy initiatives here, that when Fiji ratified the NSRP in 2017, there was also a national census in 2017. This then provided for a better push. And the benefits and outcomes of this better push is that in 2017, Fiji also then initiated the Disability Allowance Scheme. We also ensured that the process of this was to ensure that this was then aligned to what the UNSRPD is about, and to also hold government accountable in terms of processes. Now, in this process, since 2017, there's been a lot of changes. Sadly, only 3 years later, we've now been impacted by COVID-19. And COVID-19 has actually had a lot of negative impacts, as if you see the graph on the slide, when Fiji was actually announcing its 2021 budget, it had to take into consideration in terms of the economic downturn due to COVID. And the momentum from 2017, 2018, 2019, actually now is turning around and taking a drop. So the budget priorities where governments now start to prioritize their budgets, the allocation within the budget lines, one is decreasing, but at the same time, internally they shift within the budget. So the allocation for the disability allowance, which is what government provides directly to persons with disabilities and their families, that is now taken a bigger chunk. Now, the funding that often goes to the OPDs, this is now being reduced. And this is something that the OPDs are now advocating and lobbying for, is because most of the services that are provided by OPDs are actually non-existent in Fiji. These are services such as sign language interpreters that are provided by the Fiji Association of Deaf and not by anybody else. When it comes to mobility aid and appliances that are provided by the Spinal Injury Association. For White Cane and for George Software Learnings and Teachings, this is provided by United Blind Persons of Fiji. So some of these areas is crucial to ensure that the support to the organizations of persons with disability in this country and the approach in terms of how we now approach our budget advocacy has also taken a shift as a result of COVID-19. We've become a bit more technical, and this is where organizations such as the Pacific Disability Forum, Center for Inclusive Policy, has come in terms of providing this great support to ensure that the learnings from the other parts of the region, right, and how they've actually managed to solve or improve the current situation or absorb the impacts of COVID is crucial. The next slide just shows the budget trends over the last few years, mostly in recent times. So you can see by 2016, it was only $4 million. Right now, it's sitting 18. But if you look at just before COVID, it was actually sitting on 22 and growing pretty well. No? I guess what is important for us, and this is often what we often use when we do our advocacy programs with government agencies, is that we've always held them accountable in terms of duty bearers and with persons with disabilities and organizations with persons with disabilities as rights holders. Thank you. Thank you, Dan.
Thank you, Joshko. for that Fijian experience. And now we turn to another country with Meenakshi Balasubramanian from India, who's an associate with the Center for Inclusive Policy, who will talk about monitoring progress and priorities and compliance within the Indian budget. So Meenakshi, it's over to you.
Thanks, Daniel. So I'm also sharing the initiative from Center for Inclusive Policy, a data visualization project for budget and policy analysis, budget analysis. So through that, we will explore the India experience. Before we get into the budget analysis, I would like to just give a short background about India. India has 38 units, 36 units, 28 states, and 8 union territories. The Constitution of India has made it mandatory for both the central government and the state governments to get their budget approved by the legislature. Apart from that, like most countries, we follow 4 processes, that is preparation, enactment, execution, and legislative review of the budget implementation. Our budget year starts on 1st of April and ends on the 31st of March the following year. The enactment of the financial bill happens on the 1st of February every year. And for the purpose of this analysis, I've considered period from 2016-17 onwards, but we are presenting here data till 2020-21. The rationale for this is that the Rights of Persons with Disabilities Act was passed in the year 2016, which is the purpose of which is to implement a CRPD. So through this, we are monitoring the progress and also some of the priorities that we picked up from the Rights of Persons with Disabilities Act, and also the compliance of the various programs to CRPD and thus the Rights of Persons with Disabilities Act. So the key priorities that I would like to highlight from the Act is that the Act has recognized the issues of persons with disabilities as cross-sectoral. Apart from that, the Act mandates 5% of earmarking 5% of resources of all poverty elevation programs for persons with disabilities, with specific focus on women with disabilities, and also mandates an additional 25% allocation for persons with disabilities in all social protection programs. So we have 3 segments: overview, sectoral allocation, and ministry and department-wise allocation. Under overview, we are looking at the comparison between overall specific allocation to persons with disabilities, as much as we could get the disaggregated data to the gross domestic product and social sector allocations across the country. And on the screen, we can observe the trend from 2016 onwards. So in 2020-21, we can see a marginal increase in GDP allocation at 0.05%, which is 0.006% increase from the year 2019-20. But if you look at the social sector allocation, it is taking a declining trend because we have considered only few sectors: education, employment and skill development, and cash transfer. But it is taking a declining trend comparing to the previous years in the year 2020-21, which is at 0.08%. However, if we actually deeply observe, we find that from 2018-19 onwards, it is at 0.8%. Then we have looked at the overall specific allocations across country, both union as well as the state government. At the union level, this page allows for selection of countries, and we could observe, we have also presented a comparison between actual expenditure and budget estimates for few years for which the data is available. And the union's actual budget estimate is taking a declining trend, and from 2016-17 to 2018-19, we find that the actual expenditure is, mostly the resources are underutilized. And also through this, we will be able to understand what is the priority between union and states, how much is the contribution. We could observe that 20% of the resources comes from the union government and the rest from the states. But among the states, there is huge diversity, which could be observed from this web page. The 60% of the allocation comes from nearly the southern states and a couple of other states. And also we can understand the priorities by states. Even if the state has similar population and the economic level, for example, compared to the southern states, they contribute less to the allocation. For example, Maharashtra, which is the economic capital of India, is contributing less compared to all the better performing states. But we also understand for the economically underdeveloped states, many states in the northern region and northeast region, the union is not supplementing with its resources. So this is kind of a cause of concern. And then we have the next segment, sectoral allocation. Under sectoral allocation, we are looking at the major sectors that contributes that we could get specific allocation, like education, employment and skill development, and social protection. So from among the various, we compare this to GDP. From among the various sector, social protection has maximum allocation contribution to specific allocations to persons with disabilities, and it remains at 0.041% to GDP in the year 2020-21. And the next best sector is the education. The inclusive education component has 0.005% allocation to GDP in the year 2020-21. However, it takes a declining trend over a period of time. And then we also will be able to understand sectoral allocations between across state and union territories. So on the screen, I'm projecting Delhi state, where the major so the various sectors have been accessibility, education, employment and skill development, and social protection. However, the state's priority has been on cash transfer. Even within the social protection, we have 4 components: assistive device, cash transfer, rehabilitation, and institutional allocation. But the cash transfer occupies the major proportion of share of allocation at the state level. And this is kind of uniform across the state. However, not all states we have almost all the data, but it's kind of very different across states. Then we are also comparing union and the state responsibility across different sectors. So across different sectors, where we find that the union's contribution has been majority of the union contribution is on the inclusive education part. And the state has limited contribution towards education, inclusive education. However, special schools, state has taken more responsibility compared to the union. However, under social protection, the state's share has been actually the major contributor for cash transfer. And on rehabilitation, the state and union has taken equal responsibility, though it's very small, but it's taken some responsibility. Then we could also we also did a compliance analysis for across the year for various sectors. And we could observe that we have issues with compliance under 2 sectors, education and social protection, where the education, the inclusive education program of the union government has a home-based education component, which is seen as an end in itself only for children with high support requirements. And the special schools, though majority goes for the deaf schools and schools for children with visual impairment, but it comes from the social justice pool and not from the education department, which is also a problem. And then under social protection, the allocation to institutions is mostly long-term and care, which is not leading to inclusion of persons with disabilities. And the cash transfer also has its own problem because of the design of the program, which mandates incapacity to work as a criteria, and also it is targeted. Then if you look at the ministry and department-wise allocation, we could observe that only out of the many ministries in the union government, we have only 4 departments that has disaggregated data, which is apart from the nodal agency, it is health and family welfare, rural development, which implements social protection, and the inclusive education program of the education department. Mostly the health and family welfare has contribution across all the states, and it goes for running mental health institutions. Apart from that, the department, the contribution from the agencies differs from state to state. On the screen, I have given an example of the state of Chandigarh, which has 2 departments that have disaggregation of allocation. Thank you so much and for this opportunity. And we are also looking at finalizing this webpage and also expanding it to more countries. Now we have Fiji and Philippines data available, but we are still it is still in work in progress because we are in the testing stage. Thank you so much.
Thank you very much, Meenakshi. And now we turn to Katya Taya, who is a social policy specialist in the social policy program in UNICEF Ecuador, who is going to discuss her review of equity classifiers to improve budget monitoring for disability inclusion in Ecuador. So Katya, over to you.
Thank you, Daniel. Can you hear me?
Yeah, can hear and see you, yes.
Okay, perfect. So let me do this. Okay, thank you very much. During my presentation, I will provide a brief overview of the experience of the equity classifiers in Ecuador, their potential as a monitoring tool, and the current challenges that we have found in this initial work. I would like to start by explaining what is equity classifiers. Basically, they are a classification system that codes the budget according to different equity-based themes and policies. They are grouped into 7 categories, 4 of them regarding gender, disability, ethnicity, human mobility, and 3 of them related to the life cycle, as you can see in the screen. They were developed by the Ministry of Finance to enhance transparency and accountability, to provide information for decision-making on resource allocation and planning and budgeting issues regarding public policies, and also to make the financial efforts of the state visible in addressing poverty and inequality. The process started in 2005 with the attempt to incorporate the gender approach in the budget through the function K, and later through the gender classifier in 2012. Using this previous experience is how the current 7 equity classifiers were created, including disability and the focus on children and their families in 2014. Currently, the classifiers are supported by a legal basis, having the Constitution, the national laws, and planning and financial regulation as the framework. And to have a better idea of the classifiers in the disability arena, it involves 3 levels of disaggregations. The first level is spending orientation. The second level is spending focus in the case of disability with the code 02. And the category is the 3rd level. In this case, the disability classifier has 12 categories according to the policy objective. In the photo below, you can observe how the classifiers are incorporated into the financial management system in Ecuador. Regarding their potential contribution in monitoring the public budget, the classifier has been the first and the best attempt until now to link planning at budget. It could be a strong monitoring and reporting mechanism to trace resources for specific policies too. Also, it might have the potential to facilitate the access to information and transparency. Some efforts include having a platform with equity reports developed by the Ministry of Finance, and some information has been included in technical documents of the Assembly during the discussion of the budget bills, for instance. Another contribution is the mandatory legal framework, which has helped to incorporate the equity classifiers in the financial management system, as we saw before. But despite those efforts, they have been insufficient to address the implementation problems. During this initial or preliminary review, we identified diverse challenges at different levels. For instance, engagement from the different implementing institutions as aligned ministries is weak, both at political and technical levels. Currently, the implementation depends on the will of the government's officials. At the implementation level, some challenges are building capacity on how to incorporate different classifiers in the budget, conceptually and methodologically. Also improving the systematic use to provide timely information. Nowadays, it's a process that has more than 70 categories that make the identification of the budget more complex and confusing. The information available doesn't allow to develop a comprehensive analysis, such as the spending on children with disabilities under the disability theme, for example. In that sense, improving the disaggregation of the information is still a challenge. Likewise, enhancing monitoring and reporting tools and making the access to information friendly to be used by the citizens. Lastly, other challenges are concerning the registration problems. Not all the line ministries register the data. If they are allocating resources for these policies, not all of them are including this information in the management system. There is no information about the local governments. And part of this problem is that some implementing institutions use an alternative financial system that add more steps to the identification process. So finally, without any doubt, the equity classifiers have been a significant effort to measure and monitor social expenditure and social indicators in Ecuador. However, in practice, as I explained before, there are many unsolved challenges to truly meet their objective. In our efforts as a UNICEF to enhance public finance for children and their families, we are taking initial steps by developing a review of the methodology and the implementation process that will provide lessons learned and recommendations to improve budget monitoring. Along with, we are carrying out the first analysis on the expenditure for children and their families with a special focus on disability. I just want to conclude my presentation by saying that we are looking forward to sharing this ongoing work and contribute with some elements to the agenda on public budgeting. Thank you very much, Daniel.
Thank you, Katia, for that presentation about what's going on in Ecuador. And now we're going to zoom out a little bit and take more of a global view with Ola Abouelgaid, who is the head of the Technical Secretariat of the UN Partnership for the Rights of People with Disabilities, who is going to discuss the situational analysis that the PRPD has done in many countries. So Ola, over to you.
Thank you, Dan, and thanks everyone for joining us today. What I'm presenting today is the preliminary findings from the situational analysis we have conducted recently in 26 countries. The findings of this analysis will be soon on our website, but what I'm sharing with you today is just the initial insight of that. So the situational analysis was built by the UN Partnership on Persons with Disabilities in 2020 based on the new strategy we have developed. And it was mainly aimed for the purpose of designing our programs collectively at country level by all stakeholders based on evidence of what the realities are at country level in terms of disability inclusion. Because we wanted to make sure that deeper analysis is thought through by all actors to ensure that our programs are really aiming towards sustainable changes and supporting CRPD implementation and realization of SDGs at national level. The findings I'm sharing today are reflective of the 5 regions where the UN PRBD is supporting and where the UN system is presented. And as I said, more data will be available soon on those countries, but along others during the year. Now, how does CRBD compliant budgeting fits into the framework of the situational analysis and the new strategy of the BRBD? In our strategy, we have considered 5 preconditions to disability inclusion at national level. The first one is equality and non-discrimination. The second one we looked at is inclusive service delivery. Third is accessibility. The fourth is CRBD compliant budgeting, because we considered it as a key milestone in terms of CRBD implementation at country level. And the fifth is accountability and governance. Of course, they all intersect to each other, but we had to understand more deeply each one of them at national level and see where we can support. What did we look at the situational analysis? The 2 key components of analysis we looked at is trying to understand the financial planning and monitoring at national level, supporting disability inclusive budgeting, how far is that implemented, and where does it sit? The second element of analysis was looking at regulations and support for the additional cost of disability within those frameworks and processes at national level. So what did we find? From the 26 countries, all of them concluded that current national, subnational, and donor budgets are insufficient to meet the CRBD standards and the implementation of disability laws and policies. We also found out, which is probably not a surprise to many of us, that organizations of persons with disabilities are unfortunately still excluded from budget processes at national and local level. Only 50% of countries reported having sufficient systems to monitor budgets. But even on those, it was mainly centered around budgets that are for disability targeted interventions. So when it came to mainstream services and budgets, that was not the case in terms of monitoring frameworks. There was also an evident limited awareness of disability-friendly budgeting in both public and private sector. More awareness was evident on gender budgeting. So this was also a key learning for us, that we need to do more and support more when it comes to disability inclusive budgeting. There was inconsistent reporting from mainstream programs on including disability in expenditure and information on disability inclusion in national development plans is unfortunately still lacking. In terms of the second stream we looked at, which is the regulation and support for additional cost of disability. Unfortunately, budgeting for reasonable accommodation is still extremely rare in many countries. Only a few social sector ministries such as education, health, and social protection have budgets that allow for the provision of devices and services for persons with disabilities. However, many persons with disabilities had to pay for those services themselves due to the complex and bureaucratic referral processes that existed in many countries. Of course, all of that led to the conclusion that many of the situational analysis indicated that many persons with disabilities are unfortunately still excluded from decision-making when it comes to all those processes and led to their exclusion more broadly. This slide just shows to you some examples of countries where we found evidence of allocated disability funds in national budgets. Some examples in Africa, like Gambia and Zimbabwe. In Asia, we could see also evidence in Georgia. In the Americas, Trinidad and Tobago was one of the countries. But as I said, these are some examples, and we have more to share in the data that we will be sharing soon. Now, my final concluding remarks to you is that, as indicated with the previous colleagues, the CRBD cannot be effectively implemented without CRBD compliant financial planning and regulations that support for extra cost of disability. As an essential precondition for disability inclusion, CRPD compliant budgeting is a key component for UNBRPD's new strategic framework. We will continue to support countries through the situational analysis process to analyze key gaps around the inclusive budgeting, to inform future programs, hopefully supporting more realization of this component in the countries through our work. Thank you so much for everyone. Thank you, Dan.
And thank you, Ola, for that overview of what's going on in a number of countries in regards to budgeting. Well, we're not just talking about how money is spent, but how money is raised and how what the fiscal framework is. And that's what we're going to turn to in our final presentation by Alberto Vasquez, who's a senior advisor with the Center for Inclusive Policy, and who recently with Karina Huertas just finished a paper on disability inclusive fiscal policy for the Center for Economic and Social Rights. So Alberto, over to you.
Thank you. Thank you for the introduction, Dan, and hello, everyone. I think today we have heard about the importance of CRPD compliant budget analysis, monitoring, and advocacy. But all these efforts are framed under what is called fiscal policy, which is an instrument of that government use for managing spending and public revenue. And fiscal policies cover all the ways government collect and spend public resources, and this includes taxation, public debt, income obtained through public companies, micro fiscal planning, international cooperation, and all the process associated with the budget cycle that we just heard. And one can think that this should be the work of economists and not really human rights advocates, but it's actually central for our discussion today, no? Because through fiscal policies, government define the availability, the distribution, and the use of public resources. And therefore, efforts are key to reduce, fiscal policies are key for efforts to reduce poverty and social inequality and guarantee human rights. No? And if we want to make sure that the states advance their international obligations regarding the rights of people with disabilities, we need to understand how states also generate public resources. No? And this discussion is critical, particularly in low and middle income countries, where resources are scarce and countries are prone to economic crisis and austerity measures. And we know that countries tend to cut benefits and services for persons with disabilities during time of crisis. And there is clear evidence that these retrogressive reforms have increased poverty, homelessness, and even mortality and suicide among persons with disabilities in some countries. And so with this in mind, CIP, the Center for Inclusive Policy, and the Initiative for Human Rights Principles in Fiscal Policy, we have produced recently a discussion paper on disability inclusive fiscal policy. And the Initiative for Human Rights Principles in Fiscal Policy is actually a group of various organizations and experts in Latin America. And in May 2021, they launched the Principles and Guidelines for Human Rights in Fiscal Policy, which systematize human rights standards related to fiscal policy and provide also practical guidance, policy guidance to lead the implementation in practice. And this paper that, which Karina Huertas and I co-author, aims to explore how to include disability and involve persons with disabilities in fiscal policy, including taxation and the budget cycle. It will be, actually it's already available in the website of the Initiative for Human Rights Principles in Fiscal Policy, although in Spanish. And in this exercise, we identify different measures that the states are actually adopting to increase public budget on disability. For example, earmark funds, earmark taxes. Some countries are doing results-based budgeting. In a more traditional route, some countries are also relying significantly on financing through the collection of fines. And then you also have these trends between block funding and personalized budgets. But there are also important measures that can improve the quality of the spending, including, as it has been mentioned already, better data collection and identification of support needs, which involves evaluation and certification of assessment and certification of disability. A key aspect also is capacity building for public officers. So they design actually better programs, and then public awareness for mobilization. And in this exercise also we explore taxation, and we found some examples, I would say, of tax justice that are worth exploring more in detail. For example, reduced rates or exceptions for indirect taxes on goods and services for persons with disabilities, tax deductions for personal income tax, tax incentives to promote employment of persons with disabilities, which is quite common now, but also for research and innovation, or for donation to the disability sector, including organizations of persons with disabilities. And many of these benefits are actually applied in isolation or have significant access barriers. For example, very strict certification process. But I think they lead us to think about the need for the disability sector to involve in efforts for inclusive tax reform and a tax reform that could address these inequalities and invest on inclusion and human rights, including for persons with disabilities. And these efforts demand solidarity between human rights and social justice organizations, including organizations of persons with disabilities. And I think there is a point where we cannot advocate for human rights and not pay attention to the harmful impacts, for example, of corruption or abusive tax practices. No, and in fact, the regions with high prevalence of poverty are most impacted by corruption and tax abuses. No, so, and there is a final element I would like to bring, which is the issue of accountability and participation. And we have already heard about the challenges of transparency and accessibility for accessing information on public spending and different reports. And there is a recent one in the Latin American region that shows that persons with disabilities face significant barriers to access public information. And this is due to the lack of accessibility of transparency portals, the formats in which public information is requested or delivered, but also the lack of transparency and accessibility of public agencies themselves. No? And there is an additional barrier, which is the lack of population level and administrative data disaggregated by disability, as was mentioned by Eduardo. And this is also a significant limitation when you evaluate fiscal policies. And in line with Article 31 of the CRPD, the state should guarantee the availability and accessibility of quality data disaggregated by disabilities across all sectors and level of governments, as well as also has been mentioned recently, the adequate codification of budget lines related to disability, which will help to better monitoring. And for sure, we need clear mechanisms for the active engagement of civil society, including organizations with persons with disabilities in fiscal policy discussions. There are some examples of participatory budgeting, but still we're very low in the involvement in the budget cycle, but even less involved in the discussions about public fiscal policies. And we know that persons with disabilities and their families have first-hand experience of the challenges they face, and they know best what can be done to realize their rights. So I think the participation in the formulation of public budgets and in fiscal policy in general will ensure better spending and accountability. And let me finish with this final idea, which is, I think the structural discrimination first by persons with disabilities will not end, as has been said already, without more resources or budget, but also without adequate fiscal commitments. And I think we need to engage in these more broader processes of advocacy around fiscal policy, because this is the only way states will have the resources to ensure human rights for everyone. Thank you.
Thank you, Alberto. Thanks, everyone. We have an embarrassment of riches with so many presenters that I was telling people they had to stick to time limits, and they did so well that we actually have time to answer one question. that Yeti posed in the question and answer box, and Alex wanted to take a stab at that before we close. So Alex?
Thank you very much. Yeti asked, how can we track expenditure made against the CRPD in addition to the insufficiency of the budget we witnessed? And I think this is a very important question, that's why I wanted to answer live. It's not about numbers, because it really requires an analysis of the policy framework and the legal framework, but also a certain consensus among organizations of persons with disabilities. What do we consider in our country being uncompliant with the CRPD or going against the CRPD? And this has been one of the challenges that we have identified working with organizations of persons with disabilities, and within DPOs themselves, it has been a challenge, is to gain this consensus. And I think it's very important, whoever wants to invest in budget monitoring and budget analysis, there is a need to have a good understanding of principle and provision of the CRPD, but also a good understanding of the legal and policy framework of the country. And it's important also to have an understanding of the actual impact of the existing regulation, laws, program, and services. And this is not granted. So you need, and this is why in the presentation I made, I started with the result for people. You need to have a good understanding of the result for people, including the negative one, and then to look back at the legal framework and then build the trajectory of resources to implement those. But I think it's really important, this work of consensus with organization of persons with disabilities, to decide what we think contribute to inclusion, what we think contribute to segregation and exclusion, and to really qualify those before you go and look into the numbers. So that's, and it's possible. I think where we have issues is, for instance, when you have legislation or policies that are supposedly neutral, meaning they don't say anything about disability. So it's not against persons with disabilities, but it doesn't say anything for inclusion. And as Ola was saying, there is no provision for reasonable accommodation, no provision for accessibility, which means that ultimately, even if the legislation and policies don't say anything against the rights of persons with disability per se, they don't do anything for inclusion and will most likely end up discriminating persons with disabilities. The problem is those kind of mainstream programs, budget analysis is fairly difficult because there is no disaggregated data. So you really need to go into the regulations that are impacting directly spending to see, is there anything there that could support inclusion and accessibility? If you don't see anything in procurement, if you didn't see anything in regulation, eligibility criteria, yeah, it's very likely that it will exclude persons with disabilities. Over.
Thanks, Alex. As all the speakers have been saying, laws and regulations and standards are one thing, but how these things are implemented and carried out, of course, is the key. We're not just talking about how many dollars are spent, but where they're being spent, how they're being raised, and how they're being spent. And to do that, we need to develop systems and tools for this kind of monitoring. And I think you've heard today some very good first efforts for us to try to be moving in that direction, and the challenges that we have to deal with in order to be effective monitors of budgeting policy for the achievement of the CRPD. We don't have a lot of time today to have a big discussion, but we want to be able to follow up with the discussion. And so on the CIP website, the Center for Inclusive Policy, which is in inclusive-policy.org. Let me trying to share this. You can contact us there, and of course you can contact all the speakers directly for questions, but if you have questions to the group or to any of us, please contact us at the website, and we want to be able to continue this discussion going forward and sharing our experiences so we can build these monitoring systems together. So thank you very much for attending, and thank you to all the speakers for all the work you've done and for coming and sharing it with us. And have a good rest of the day. Take care, everybody. Bye.